Obesity is a spectrum, and where we start talking about obesity that needs to be intervened on is class 1 obesity, which is really a BMI over 30. On average people, that's around 30 to 50 pounds overweight. As you start accumulating weight, you also start accumulating medical problems. Over the last several years, we've realized that obesity and the comorbidities associated with weight, excess weight, including diabetes, high blood pressure, sleep apnea, heart failure, irregular heart rhythms called atrial fibrillation, also many cancers. The root cause of that is obesity. And Summa had the insight back in the early 2000s to develop a comprehensive program. We began with the surgical program in 2004, and over the years we've added an extensive medical component to be able to offer all of the services within weight management, and at that point we became the Weight Management Institute. Across the spectrum of obesity, there's some people that need surgical therapy, and a lot of patients where we would hope we never get to that point, and that we can manage with medical therapy. We have 3 obesity board certified physicians in obesity medicine. We have 4 psychologists and we have 4 dietitians. It's designed to be a 2-year program to help you from the beginning, changing the way you eat, affecting and evaluating for things like insulin resistance, things may be affecting your ability to lose weight, and then making sure we implement exercise, behavioral modifications, and really focusing on the overall patient. And trying to get away from fad diets, pills, one episode of care. This is a long-term, long-standing process that is going to take a disease process that most people have had and suffered for many years. If that's not able to be successful, then we can transition you into the surgical program. Patients are never done, and that's how we build that program. Again, whether it's the medical program or especially after surgery, our goal is to provide long-term, lifelong comprehensive care. We certainly work collaboratively with the primary care physician and any other specialist that that patient may have, but we want to be that anchor that holds them to dietary control, exercise, and if they need any other therapies. As you lose weight, you're going to do several things. Number 1, improve diabetes control. Take away the diabetes medications completely. Improve high blood pressure control. Remove those medications completely. Improve sleep apnea to the point where you don't need a machine to help sleep at night. The goals and objectives for each patient may be different. As a young person who may not suffer from disease processes yet, my goal is to make sure that we never get that. I never want to see disease processes develop, high blood pressure, diabetes, or sleep apnea. Interrupt the process of obesity and help them reclaim their life. That's our goal, is to give them their life back. Learn about the disease process, learn about weight management and what we can offer, and come in knowledgeable. Have that conversation with your primary care physician, discuss it with your family. Support is going to be paramount to your success across the board. It is extending life, curing disease processes, and improving all facets of relationships, independent living, and just being happy.